I'm Dr. David Hill, and today we're going to talk about how to reduce acid reflux caused by anti-inflammatory medication. Now, anti-inflammatories or non-steroidal anti-inflammatories, we call those NSAIDs in the medical terminology, are incredibly powerful and useful medications for everything from headache to fever to various forms of arthritis. They can be terribly useful. However, no medication comes without side effects, and nonsteroidals are absolutely no exception. In fact, some of the worst side effects of nonsteroidals involve the stomach. They can cause erosions within the stomach because they prevent the stomach from protecting itself from stomach acid. So what can we do for that? Well, the single most effective medication to take while you're on nonsteroidals is now over the counter. It's omeprazole or Prilosec. This class of medications is called a proton pump inhibitor. And the proton pump inhibitors work by stopping the cells within the lining of the stomach that make the stomach acid itself from working. What do those cells do? They pump protons, that's acid, out into the stomach. A proton pump inhibitor stops them from doing that. When there's not so much stomach acid, the chances of damage to the stomach or esophagus from that acid go way down. So a lot of us who know that our patients are going to be on nonsteroidals for a little while, or maybe have had some other problems with reflux or stomach acid related disease in the past, will simultaneously recommend a proton pump inhibitor. Now, if omeprazole or Prilosec has not worked adequately, you can combine that with what we call an H2 antagonist. That's a histamine type 2 antagonist. Those are medicines that are very familiar to you. You've heard of Zantac, Pepcid, those are ranitidine, nizatidine, cimetidine is an old one that we've had around for years. You might be taking that at night, and a proton pump inhibitor during the day in combination will do an even better job of suppressing the stomach acid. Now, different people respond differently to various versions of a drug. So if omeprazole didn't work for you, and we've already added the ranitidine or the nizatidine to that, not gotten anywhere, it may be time to change to a different proton pump inhibitor. And there are several drugs in that class right now. The omeprazole is the only one over the counter, so you need to talk to your doctor about what alternative he or she thinks may work best for you. Talking about preventing esophageal and stomach acid problems as a result of taking nonsteroidal anti-inflammatories, I am Dr. David Hill.